First, I'd like to thank also the Lupus Foundation of America for giving us this opportunity for talking about this very important topic. So we're first going to start off with an overview of heart disease among lupus patients. We'll give you some statistics and then explain to you why we think that lupus patients are at higher risk of heart disease. Then Dr. Weber will talk about some of the important risk factors for developing heart disease that apply to not just lupus patients, but also to the general population. Then we'll focus on some of the risk factors that are more specific to lupus patients only. And then we'll wrap up our talk with some exciting new research that we're both involved in to address this problem. So to start off with, let's talk about some good news in lupus patients. So overall, we're seeing that our patients are living longer and longer. So the prognosis has dramatically improved over the years. In the 1950s, for example, the probability that an individual will survive at least 4 years after the diagnosis of lupus was around 50%. And then by 2000, the 10-year survival, so the probability that an individual will survive at least 10 years was increased to 90%. This is probably due to multiple different factors, but certainly improved therapies for lupus kidney disease has made a huge impact, and also treatments for infectious complications. Both of these are major causes of mortality for lupus patients. So we have new drugs, as you're probably aware, for the treatment of lupus. For over 50 years before the approval of belimumab in 2011, there wasn't any new drugs coming out. But in 2011, belimumab became the first ever targeted biologic therapy for lupus. And then in the last couple of years, belimumab became approved for lupus nephritis, voclosporin became approved for lupus nephritis, and then anifrolumab became approved for moderate to severe forms of lupus. So we're all very excited and hoping that this trend of new medications coming out will continue. On the other hand, there's still some bad news for lupus patients. Unfortunately, lupus is still a major cause of death among young women. So although lupus is an uncommon disease, relatively speaking, it is an underestimated cause of death, particularly in young women. So if we look at the statistics, it is a #1 leading cause of death among females aged 15 to 24 years, among those with chronic inflammatory diseases. It is the #7 leading cause of death among females aged 15 to 24 years in general, and then the top 15 causes of death among females between 10 to 44 years of age. So what are the top causes of death among lupus patients? These are active disease like active lupus nephritis, infections, and of course, cardiovascular disease, which is why we're talking about it tonight. So heart disease, the risk for heart disease is 2 to 3-fold higher in lupus patients, particularly in those who are young with new onset disease. Coronary heart disease, or CHD, causes up to 30% of deaths in lupus patients. And the mortality from coronary heart disease in patients with lupus is 9 to 11 times higher than somebody who doesn't have lupus in the general population with coronary heart disease. So next, Dr. Weber will take you through why we think that our patients are at higher risk of developing heart disease.
Thank you very much, Dr. Choi. And again, thank you to the Lupus Foundation for the opportunity to talk to you guys today about what is very important and what we are both very passionate about in terms of our patient care and our research. And so the first thing I'd like to talk about is this idea that the atherosclerosis, which is the presence of plaque buildup in the arteries, is accelerated in patients with lupus. And so among asymptomatic people, so people who do not have symptoms of chest pain, studies have found that patients with lupus have much higher rates of plaque in their arteries when you look at CT scans at all age groups. And in fact, that's what this figure on the right is showing you, is that it's showing you in patients with lupus who are in the kind of dark blue greenish compared to the control at all ages, whether you're under 40, 40 to 50 or above 60, there was a much higher presence of plaque detected by these CT scans compared to patients without lupus. Additionally, prior studies have shown that young women, ages 35 to 44, have over a 50-fold time increased risk of a heart attack compared to healthy young women the same age in one cohort study. Next slide, please. And so this brings me to this concept of atherosclerosis, which is the plaque buildup in the arteries. And this is a multi-step process, and this is an inflammatory process. This is well described on how it starts. And so in some level, the endothelium, which is the lining of your blood vessels, become damaged in some way. And this can be due to a variety of causes, but there's that initial damage. And then there's the recruitment of inflammatory cells and this idea, this fatty streak, which is kind of like the cholesterol that we think of that can kind of get laid down with all this inflammatory component. And that over time builds up. So that's where the plaque grows in size within the vessel. And ultimately, eventually what will cause a heart attack is when that plaque ruptures. And that's what's showing you here. And then on the next slide, this actually will show you the process of that. So this is real human arteries in cross-section from a very famous study in medicine many years ago now, where we're showing you a normal artery on the top. You can see it's nicely opened, and the white is like the area, the opening of the blood flow. And then to the top right, you can see that there's that plaque buildup. So that's moderate kind of narrowing of the opening of that blood vessel. And then the bottom left, you can see that becomes more and more occluded over time. And people at that point may be starting to develop chest pain because they're not getting enough blood flow to the heart. And the resultant heart attack will happen when that plaque ruptures, which is the bottom right. And that's when it actually occludes the vessel. And that's what when we say the term myocardial infarction, that's the medical term for heart attack. Next slide, please. And so let's talk about some of the common cardiac risk factors that are common in everyone. And then Dr. Choi is going to walk us through what are the risk factors that are specific to lupus that we've also found through various research and that we have to think about in terms of patients with lupus. And so the traditional risk factors are the ones that many of you may be aware of. That is, hypertension stands for high blood pressure, high cholesterol, and not just, there's multiple components of cholesterol. Smoking, one of the strongest modifiable risk factors we know of, and modifiable means you can change it. Diabetes, obesity, so being overweight, a family history of heart disease. We also know that as women age, they have a higher risk of heart disease, and it's thought to be postmenopausal. So when you lose that estrogen and above the age of 60, that's also a risk factor for coronary artery disease. And then the lack of exercise. Next slide, please. And so I'm going to talk about each cardiac risk factor individually. So let's look at hypertension. So what we have found in studies is that patients with lupus have a much higher prevalence of high blood pressure than normal people that were aged and sex matched without lupus. And it increases your risk of having heart disease by 5 to 6 times. So it's a very important risk factor. It's also been shown in lupus patients to be associated with the kidney disease that can often become involved with lupus. And it's also worsened by prednisone use. So long-term prednisone use is also associated with higher blood pressures. This figure on the right is just showing you patients with lupus that are in the black, and the white bar with the dots in it is patients without lupus. And it's just showing you that they have these are much higher percentages of high blood pressure among all age groups. So it's not just specific to one age. So what are the treatments for high blood pressure? Well, that is weight loss is a very effective treatment to lower your blood pressure. Exercise, a very effective measurement. A low salt diet, which is key, and then medications. And in particularly, we found that kidney disease that can often be affected in lupus, that these drugs called ACE inhibitors, lisinopril is a common name, some people on the call may be aware of, are very protective for the kidneys. Next slide, please. So then we can talk about high cholesterol. So prior studies have looked at this and have found that the prevalence, so how common high cholesterol is, it's much more common in patients with lupus than patients without lupus. What are some other factors it's associated with? Well, it's strongly associated with steroid uses. So that would be the prednisone use. And in fact, one study showed that if you increase your prednisone use by 10 milligrams per day, that actually increased your total cholesterol by 8.9, which is a pretty significant increase in the numbers how I interpret. The anti-malarial drugs, such as Plaquenil or hydroxychloroquine, has been shown to improve the lipid numbers, the cholesterol numbers. It's also associated with active disease. So the more active your disease are, the worse your cholesterol. Kidney disease, having protein in your urine, which is a sign of the kidney disease, and then longer duration of the disease. So people who've had lupus for longer are more likely to have high cholesterol than patients who've had it for a shorter period of time. And so how do we treat high cholesterol? Well, the number one thing we always recommend to all patients is to modify the diet. So dietary modifications is really important. Aerobic exercise also improves your cholesterol. And then really important is lipid lowering medications, and in particularly statins are the drugs that we commonly use that will lower the cholesterol values. Next slide, please. Cigarette smoking. Well, this is a risk factor that, similar to all these risk factors I'm talking about, are not just risk factors in lupus. And this is not more common in lupus. It's just a very strong risk factor. It is actually one of the strongest risk factors for heart disease and increases your risk of a heart attack by over 5 times. So this figure is from the World Health Association, and it's just showing you the impact you can make on your health by quitting smoking, and that after 5 years of quit smoking, you've now reduced your risk of stroke and almost a heart disease to the level of if you had never smoked. So it's very important in management to do everything we can do with our patients to help them to quit smoking. Next slide, please. Diabetes. And so when we talk about diabetes within lupus, we're talking about mainly type 2 diabetes. So that would be the adult onset diabetes. This is different than the type 1 disease and diabetes that people get when they're young. That's an autoimmune disease. And this is the impaired ability of your cells to metabolize sugar. It increases the risk of coronary heart disease. And so patients with diabetes, their risk of heart disease is more than 20% fold increase. So it's a very strong risk factor independent of having lupus. It's also been shown that steroids, long-term steroids use, can actually increase your blood sugar and actually can lead to the new onset of diabetes with long-term use. So we often will be checking people's blood sugars when they've been on prednisone. There has been reported to be a high prevalence of undetected diabetes, or this pre-diabetes in lupus. This was a very old study. This idea that there could be kind of mild levels that are not being detected. And then what are the treatment strategies? Well, diet, again, you see that's a common theme. That's a very important modification to controlling your blood sugar. Weight reduction also improves diabetes, exercise, as well as medications. Next slide, please. The next topic, the next risk factor I'd like to speak about is obesity. There is a epidemic in the United States. This is not just unique to lupus. This is something that we are dealing with within all of cardiology, but it's a very important and modifiable risk factor, meaning you can change it. In one study, they showed that that looked at the prevalence of patients with lupus, showed that there was 38%, so under half, but still a high prevalence, were morbidly obese, which is a very high body mass index. And that the higher your BMI is, the higher associated heart risk you have. It's also been shown, let's talk about the medications, that steroids can increase your appetite and they can also lead to weight gain. So that can be a big struggle for patients who are requiring high-dose prednisone. And then there's the American diet, not surprising, especially with the high prevalence of fast food, as well as the sedentary lifestyle. And again, treatment, as a common theme on these slides, is diet. We recommend low-fat diet, low-calorie diets. Exercise is critical. So in addition to diet modifications, it's really getting in that exercise as well. And then those things happen first, but then the next step would be actually medications geared towards weight loss. But this really requires a multidisciplinary approach and often involves both cardiology as well as nutrition. Next slide, please. Sedentary lifestyle, that was kind of a risk factor that I mentioned on this previous slide as that is part of the cause of the obesity epidemic, but it's a risk factor independent of being overweight, hypertension, or diabetes. So even if you're not overweight and you don't have high blood pressure or diabetes, just not moving very much is also a risk factor for an increased risk of heart disease. And this is really common, especially when people are living with diseases where they're having ongoing pain. And in fact, it's a sobering statistic, but in one of our cohort studies here at the Brigham that was led by Dr. Constanbader, 85% of lupus patients who filled out the survey said they actually don't get any regular exercise. Next slide, please. Just a few other risk factors. As I mentioned on the earlier slide with postmenopausal, estrogen is thought to be protective against plaques or atherosclerosis, heart disease in younger women. And then you have that increased risk after menopause. And then family history of heart disease is a very strong risk factor. In one lupus cohort, people who had a family history, it increased your odds of having heart disease by 30%. And when we talk about family history, we're often asking our patients, was your mom or dad? Do you have first degree relatives? We'll also ask one generation above. And what we're particularly interested in is early heart disease. So that would be people in the family who had heart attacks at young ages, under the age of 50 or 55. Unfortunately, a family history is not something you can change. Next slide, please. And this slide is actually a beautiful study that was done by Dr. Constanbader, again, here at the Brigham, where she surveyed patients with lupus at our hospital and asked them how common do they have the different cardiac risk factors I just went through here. So you can see on the graph there's high HTN means hypertension, and then high cholesterol, smoking, DM means diabetes, obesity, and then a sedentary lifestyle. This pie graph is showing you what percentage of patients had more than one risk factor. So the blue and the green is 1 and 2 risk factors. And I want to just point out that having cardiac risk factors within lupus is common. In fact, 61% of patients in the survey had 1 or 2 of these risk factors listed here. Next slide, please. And then I'm going to hand this back over to Dr. Choi, who's now going to walk us through, in addition to those traditional cardiac risk factors, what are the lupus-specific cardiac risk factors that we've learned about?
Thanks, Dr. Weber. Yeah, so if you take into account all of the traditional cardiac risk factors that Dr. Weber talked about, lupus patients are still 7.5 times higher risk of heart disease than someone who does not have lupus. And this is likely due to some of the more specific risk factors just applicable to lupus patients. So Dr. Weber talked a lot about steroids, and so indirectly, steroids can also increase your risk of heart disease through increasing your blood pressure, altering your cholesterol, increasing your blood sugars, inducing diabetes, obesity, and it is also a marker of active lupus disease, which leads to inflammation in the body and in the blood vessels. And so although steroids are an effective and fast medication that is commonly used in our lupus patients, especially when their disease is active, it's important to consider how can we use the lowest effective dose for the shortest period of time. Another very important lupus-specific cardio risk factor are the presence of these proteins in the blood called antiphospholipid antibodies, and your rheumatologist may have checked you for these. And so these are proteins in the blood that play a role in the clotting cascade. And if they can be detected in your blood, they increase your risk of clot formation in the arteries and the other blood vessels, which can lead to heart attacks, strokes, and recurrent miscarriages. And there have been some studies that have linked the presence of these proteins to increased risk of heart disease by damaging blood vessels and speeding up the process of atherosclerosis. So the three typical antiphospholipid antibodies are the lupus anticoagulant, anti-beta-2 glycoprotein 1, and anticardiolipin. If you have all three of these proteins in your blood, your rheumatologist may consider putting you on an aspirin. If you have any of these antibodies or these proteins and you've had a history of clot, then you're likely to be put on blood thinners, again, to prevent these events from happening. We also know that active disease in itself can increase your risk for heart disease. How does this happen? Well, if we take the blood samples from patients with active disease, what we can see is that they have altered cholesterol metabolism. So you can detect higher levels of triglycerides and very low density lipoprotein and decreased HDL. They're in a procoagulant state, meaning that they're more likely to form clots. And one of the markers of that is something called fibrinogen. And so you can see higher levels of that in patients who have active lupus compared to those who have inactive lupus. There are signs of vessel damage and inflammation, which can be detected in blood, which include complement activation. And in patients who have a particular form of lupus called lupus vasculitis, where the lupus is actually attacking the blood vessels and causing inflammation in that area. And then Dr. Weber talked about endothelial function. So again, the lining of the blood vessels. When there's damage there, we know that lupus patients have an inability to repair those blood vessels. And in the blood, you can measure that through this marker called plasminogen activator inhibitor. So the disease itself, when it's active, can lead to these changes in the body that can increase your risk of heart disease. So it's not surprising then if you went to your general practitioner or your cardiologist and they wanted to calculate your risk of heart disease in the next 10 years, and they use a calculator or a algorithm that was designed for somebody who doesn't have lupus, then their risk would be vastly underestimated because they don't take into account steroid use, the presence of these proteins, and disease activity. And in fact, that is what the research has shown. So for example, Dr. Esdale et al. Found that the Framingham risk model, which is a model that is designed for the general population, it vastly underestimated cardiovascular disease risk in lupus by 2 to 3-fold. Jaffrey et al. Also confirmed that another tool called the 2013 American College of Cardiology, American Heart Association was also discordant in estimating the risk of heart disease in lupus patients. In our own cohort of lupus patients at the Brigham and Women's Hospital, we wanted to see how discrepant this result was. So what we did was we looked at how many patients had events, a number of events that were actually observed in real life, and then the number of events that were calculated using this traditional tool that was designed for the general population. And so what we found was even in patients with mild disease or in remission, they had 12 times more heart attacks and strokes than what was calculated by this 2013 ACC-AHA tool. And as you can see, as you increase the disease activity of these patients, this discrepancy was even higher. And so how can you lower your risk of cardiovascular disease addressing the more lupus-specific cardiovascular risk factors? So one, you should, with your rheumatologist, manage the disease activity. We talked about using the lowest effective dose of steroids for the shortest period of time. There's also evidence that hydroxychloroquine lowers CHD risk, and the studies have shown that those who are adherent to the hydroxychloroquine had lower risk of CHD compared to those who are non-adherent. And then obviously, if you have these antiphospholipid proteins in your blood, you've had a history of clot, you're high risk, then you should be anticoagulated. And lastly, it's important to understand your risk of heart attacks and strokes. And it's important that you use a more specific calculator designed for lupus patients. And this is one of the areas of interest that Dr. Weber and I are doing research in. So just to wrap up this part of the talk before Dr. Weber talks about more of the other types of research that we're doing, we talked about how CHD is frequent in lupus patients and that there are risk factors that are present in the general population that are applicable to lupus patients. But lupus patients also have more specific risk factors that even increase their risk even more. And we can decrease this risk by addressing some of the modifiable lifestyle changes, so things that you can do something about, as Dr. Weber mentioned, and through medications and managing your lupus disease activity. So next, I'll let Dr. Weber talk about some of the exciting research that we're involved in.
Thank you very much. And just in the last few slides, I just wanted to walk you through some it's more sophisticated imaging stuff, but I'm going to try to explain it very clear with some of the research we're now doing. And first, this first slide is just to show you what I do. What my focus is actually on is on cardiorheumatology. So my clinic is filled with patients with autoimmune diseases, of which a large portion of those are lupus patients. And this is just to raise awareness that even though we're only talking about, heart attacks and the risk factors that lead up to the events such as atherosclerosis today, lupus can also affect the heart in many other ways that we didn't talk about today. In addition to what we are speaking about, it can actually cause pericarditis. So that's inflammation around the lining of the heart. It can also, lupus can also be associated with valve disease, whether that is actually leakiness of the valves or blockage of the valves that can happen. And then you can also have myocarditis, which just means inflammation of the heart muscle, as well as heart failure. That's when fluid builds up and you have inadequate blood output to be able to, and then you have symptoms such as shortness of breath and lower extremity swelling, and you can have different forms of heart failure that can also happen with the lupus. Next slide, please. So going back, so that's the broad scheme, but going back to what we've been focusing on this talk about, which is atherosclerosis. One of the aspects of the work Dr. Choi and I are doing are really trying to understand the role of inflammation in this process. And this picture is just showing you that when we think about the blood vessels, there's kind of three broad categories you can think of. This left picture is actually showing you an angiogram. Like say somebody was going to get a cardiac stent, this is like what the picture would look like. These are the large vessels of the heart. So when we talk about heart attacks, we're usually talking about one of these big vessels being blocked. So those are the big vessels. You can also just have diffuse plaque in your arteries. And so that would be just kind of non-obstructive blockages of the heart. And we can detect that by some of the imaging called with CT scans. On the far right, though, which is the focus of our part of our research, is actually looking at those small vessels. So these are actually, the top is at an angiogram, so it's looking at with X-ray technology, and the bottom is a ex vivo, so a heart that's been taken out and then kind of look where you kind of put the stuff in so you can see all the vessels. And it's really to point out you have this abundant microvasculature of your heart. So these abundance of these small vessels that we can't see with these other imaging modalities. And that is this microcirculation, what we've been focused on. Next slide, please. And so I want to bring up a concept, and I know this is a challenging concept, but I want to just simply describe what it means and how we are using this to try to understand how inflammation within lupus can affect the blood flow. And so we look at something called the flow reserve of your heart. So it's really just a measurement of how well your heart is responding to the blood flow, including the large vessels that all the evidence of the diffuse plaque in your arteries, the remodeling of those vessels, and then the small vessel dysfunction. And what is that effect on how well your heart is pumping? And so it's kind of, if you think of it kind of like from a physics model, like you have pipes, is that we are simply looking at flow across that entire length of the blood vessels. And so we're calculating the actual amount of blood flow. To do this, we dilate your arteries with a test called a PET scan, and that causes dilation of the arteries, which is how you mimic exercise. So that's your blood flow at your peak exercise level. And then we divide that number. So how much can your blood flow augment over what your resting value is? And that gives us a value. And we know from many studies now what normal values are and what abnormal values are. And particularly the reason this is so important is that prior studies and just the general population has shown the importance of this value. In fact, we use this clinically as cardiologists because a low CFR is actually a very important predictor of all-cause outcomes, including heart disease and death. And so we use that number because it's very predictive. Next slide, please. So I'm going to tell you about one study that we did where we looked at this question within our lupus cohort at the Brigham, where we wanted to ask the question, do patients with lupus who've had PET scans at our hospital, do they have more small vessel dysfunction than patients without lupus when we match them? And so we looked within our PET registry here at the Brigham, and this study design is basically just showing you that when people get PET scans, we get a lot of data. We not only get the blockages, so that would be those big vessels that I showed you. We also can look at the amount of plaque you have in your arteries. We can look at that absolute blood flow that I just described the concept. And then we can also tell you how well your heart is pumping, the heart function. So we get a lot of data from PET scans, and this is a form of a stress test. And so what we did is we looked within our registry and we found all the patients with lupus, and then we matched them to controls that were the same age, the same gender, and had the same risk factors. And then we looked at the blood flow. Next slide, please. And what we found was that patients with lupus had a higher prevalence and lower values than patients without lupus when we talked about their blood flow, indicating that they had more microvascular dysfunction. This figure on the right, we can sort of just ignore, but all this is meant to show you is that we also looked at the amount of plaque and we said, could that amount of plaque actually be the result of this finding? And we found that the plaque, the level of calcium within your arteries as a measure of the plaque was similar, suggesting that it was not just the burden, so how much plaque there was in their arteries, but it was actually the dysfunction of the small vessels. And then in data that I'm not showing you here, we also found that that value was actually correlated to how bad the lupus disease was at that time. Next question, next slide. And so that's going to leave me with this last question. And this is some of the work that Dr. Choi and I are working on. And in the future is what we would like to address in the future is kind of the next big question is, if patients with lupus have higher levels of the small vessel dysfunction, does the treatment with the anti-inflammatory, so your lupus treatment, does that improve those flow values? So can we intervene early? And those are studies that we're hoping to do with further research funding and trials. And I believe that is the last slide. And so I just want to sum up by just kind of capturing some of the this brief cap of the work we did, where we're really using imaging to try to understand how the inflammation of the disease is affecting the blood vessels. And also, we're trying to translate that into how we can improve those blood flows. And so Dr. Choi and I just want to thank you very much for listening today. We also want to a huge thanks to the Lupus Foundation, as well as Dr. Karen Constantbader, who is one of Dr. Choi's and I's mentors, and a person who is phenomenal, a strong lupus advocate that we both work with at the Brigham.
Thank you so much. That was incredibly helpful information, clear and important. Also very.
Hi, Lupus Warriors. My name is Courtney Mitchell. I'm a patient engagement liaison with GSK. I'm actually a nurse practitioner who practiced rheumatology for 10 years, treating and caring for lupus patients like yourself. So those of you living with lupus and lupus nephritis are very near and dear to my heart. I know that living with lupus is very hard, so I would like to introduce you to our Us and Lupus website. The website has some great information around symptoms of lupus and lupus nephritis and managing your illness. There's also a symptom tracker kit that you can download to track any new symptoms or flares that you may have between your doctor's visits. This is a great tool to share with your healthcare team to better manage your illness. I encourage you to learn as much as you can about your illness so that you can partner with your healthcare team for better management and outcomes. The website is usinlupus.com, usinlupus.com, and it's very simple. Just go to the website, scroll down, enter your email address, and then make sure to scroll down just a little bit further and hit submit. GSK is thankful to be a part of the Matters of the Heart event tonight. I hope you all have a great evening.